just to be mindful of the time. So thank you everyone for coming. Welcome to today's webinar on Digital First for Health strategy and key initiatives to support clinician involvement in Ontario health teams. And today's focus will be on eServices, the provincial program, and how that supports and aligns with the work that OHTs are planning and implementing. My name is Silas Ng. I'm a manager from the Digital Health Program Branch at the Ministry of Health. And I'm going to help to just facilitate this session just to ensure that we keep on track and leave some room at the end for Q&A and some discussion. So the agenda is broken down into three parts. There's a short overview of the Digital First for Health strategy. There's going to be a deep dive on the eServices program and how that fits into OHTs. And then there's about 15 minutes near the end that we've allocated for Q&As. So just in terms of housekeeping, if you have any questions throughout, I believe you can put it in the chat box, and we have a team here that will be managing that box and will be able to answer those questions during the Q&A portion. So before I just hand it over to the presentation, let me just introduce the presenters and the panelists so everyone's aware of who's here. So from the Ministry of Health, it's myself. I also have Greg Hine, who's the Assistant Deputy Minister for the Digital Health Division at the Ministry of Health. From Ontario Health, I have Angela Tabando, who's the Interim Executive Lead for the Digital Health Excellence in Health. And Dr. Erin Keeley, who just joined, who's the Clinical Lead for the eConsult Center of Excellence in the eServices program, and also an endocrinologist. We have Dr. Claire Liddy, who's also a clinical lead from the eServices program and a family physician. And then Dr. Mohammed Al-Rakia, who's also a clinical lead from the eServices program and a family physician. So thank you everyone for joining. Let me just hand it over to Greg to kick us off.
Great, thanks very much. Really heartened to see everyone that's shown up. I think this is going to be a really worthwhile session. You'll learn a lot about two outstanding initiatives that are now part of a single program called eServices. And as Silas said, my job is to give you a sense of the overall strategy on digital health. Some of you may have heard it in the early days, but we'll provide an update. So if you could advance the slide. So this honeycomb gives you a sense of the big objectives of the digital health strategy. The government, in working with us, tried to strike a balance between initiatives that are intuitive and easy to understand and have good retail value, as well as having important outcomes for health, but also combining that with some more technical, kind of infrastructure-oriented, maybe for some a little boring sounding, but still really crucial. So if you just walk around that, starting maybe with virtual care, and I'll just say, wow, virtual care obviously has really taken off with the introduction of the OHTs codes, the so-called K codes, in addition to the legacy program that we had in Ontario that for video conferencing that's still proving to be really important. The government pre-COVID, let's pretend we're still pre-COVID, was determined to make virtual care as important as it is in high-performing jurisdictions around the world. You've probably heard stats before that when it comes to primary care, virtual care can really take up a lot of the load. And this is, there are lots of good aims of virtual care, including improving access, and not to be underestimated, patient convenience as well. Never mind the benefits in a public health crisis of not having to go face-to-face and expose yourself. Moving around the honeycomb, online appointment booking. As I said in the past, our minister, like other ministers we've heard before, they always use the reference point of restaurant booking, and why can't we do it in healthcare? Everyone in this meeting probably appreciates it's more complex than a simple transaction for a restaurant, but nevertheless, we do take up the challenge, as I'm sure you do as well, that it's important to vastly improve the way that Ontarians can make appointments and to do so online. And there are lots of single health service providers that do that now, but we want to really advance that and start doing it in an integrated way over time. Digital access for patients, this is what was always promised and where we slow down as a province in giving direct access to a patient's own health record, make it meaningful, have different ways to consume it, not just a static website. So there are lots of goals embedded in that. Shifting over to the right, the red part there is where eServices sit, and it's a kind of diverse array of objectives in order to improve the way that the health system offers services to make it more seamless, more integrated. Lots of money's been spent on provider systems, but I'm sure you appreciate that there's still work to do, including the fact that we probably have too many frontline provider systems, and the experience of Ontario health teams shows the level of fragmentation that exists. There are lots of ways to talk about it, including something that we're proud of, that with Ontario Health and other partners, we've made strides when it comes to the digital health information exchange to achieve, on the path to achieve interoperability. The last part of that honeycomb on the lower right sounds kind of policy wonkish, data integration and predictive analytics. What's really astounding there is that the government directed, because of COVID response, that we quick start the Ontario Health Data Platform, and that's houses an impressive array of data and will continue to consume more and more data, and is on a high computing environment. In fact, 2 environments right now, the second of which is opening. And there are lots of opportunities for us to maximize our rich data sources, and we'll have a pretty ambitious agenda to do so that we'll be talking to folks about over the next 18 months or so. Switching slides. Wow, COVID. I mean, it's turned everyone's lives upside down. It's posed some very significant challenges to the healthcare system, and has created some opportunities. There have been some silver linings, and I think everyone's experienced, whether personally or part of your organization or friends and family, that virtual care is a much more important part of health service delivery now. And we want to make sure that it stays that way, that the increased usage doesn't just dissipate and we go back to an over-reliance on face-to-face. We have to find that optimal mix. Obviously, it depends on patients, on treatment, but with our OHT division colleagues, with the Medical Association, with other partners, we want to figure out the best way to offer video conferencing, phone interaction, and secure messaging in ways that are appropriate and cost-effective and not burdensome to providers. The second real insight is, wow, we do need streamlined navigation services. That Telehealth Ontario was burdened in the beginning. It was resourced up. It does its job, but it's a legacy system, and it's a little bit old-fashioned in its reliance on phone interaction. So we've been working on a new navigation service as a single digital front door through innovative competitive procurement, and it will offer multiple modalities and ways for Ontarians to acquire information about the health system and how best to receive care. And while it's not the focus of today, there will be an important part of the provincial layer of that and how it relates to Ontario health teams. The next lesson learned is it's challenging for patients to figure out how to receive care in a seamless way. And we think that digital identity is going to be a huge advance, and that will allow, if you'll forgive me for comparing it to Apple, but if you have an Apple device and an Apple ID, it allows you to consume lots of services. We're working with the Ministry of Consumer and Government Services and the Ontario Digital Service to figure out the best way to allow Ontarians to maintain a digital identity so they can securely access their health information. I've already mentioned interoperability. I think COVID just underlined that it's not a kind of formal technical problem, but it's one of patient safety because we absolutely just need to have better connected systems, and we need to catch up in that respect. And tons of work has happened in that regard, as I mentioned. I guess the last one for just consideration today, lessons learned, is that if you look at dollars spent or time spent, certain parts of the sector have received a lot more attention than others. That's been the case outside of digital health, but it's certainly true for digital health. And we want to work with you and other partners to correct that. So you'll, I think, be aware that we produced a digital health playbook, and it tried to accomplish a number of important objectives, including giving your organizations a sense of the panoply of existing digital health assets and how they can be harnessed effectively. And we as the Ministry and Ontario Health and other digital health delivery partners have organized ourselves too in order to figure out how to adapt some of those programs and to ensure that they meet Ontario Health Team needs as those evolve. And I think today is a good example of, and you'll hear how eServices can really help you achieve your objectives. And an important part of the playbook was giving a sense of the policy guidance that we've continued to pursue, including on the importance of integration and how all of those assets interact with each other. It's clearly not satisfying to have a laundry list of digital health initiatives that just accept the status quo. That the playbook, one of its objectives was definitely to show that the progress towards a more integrated health system. Next slide. So I won't spend much time on this since it's the purpose of the whole presentation. Maybe just to say that previously eConsult was a separate program, as was there were a few eReferral initiatives in the province, and along with the clinical leads and with direction from the government, we thought it would be much more effective to have a single eServices program. And it really, the essence of that, as you see in that blue box, is anything that supports improved clinical workflows, things that help transitions in care, things that improve the patient experience. There are a whole list of benefits that come from both of these initiatives, and lots of other stuff that we could be thinking or achieving to, like e-ordering, when we get the capacity to do so. It's backed by not just the two components of eServices, but a whole bunch of other delivery partners. That's why Angela Tomando and others are here today. Ontario Health is an important partner, certainly, in eServices. And I think I'll leave it at that, except to say really excited to have this session and hear people's response to what you're going to hear today. Over to Erin first, I think.
Oh, great. Are you able to hear me?
Yep.
Yes.
Right, super. So We are really excited to be here and share with you the work of the eServices team. We hope at the end you'll be able to know what the eServices program is, including eConsult and eReferral. But really, it's about how to understand and use these services to support your priority patient population, and to identify how we can work with you to support the access for the services and care that you need for your population. Next slide, please. So Claire and I started the journey of the eConsult 11 years ago now about a single patient who was going to wait too long to see an endocrinologist. I happen to be the head of the division, and so was the one responsible for trying to make things better. So we started with wait times, but we know, and especially for patients and populations that may not have the same access to health care, it's not just wait times. It's also availability of whether you have a specialist of that in that area, in your community. If you have to have an appointment during the daytime when you're working and you can't leave work or you'll lose wages, transportation, the acceptability and comfort, and we see that especially in the transgender population, the ability to participate in the appointment, whether it be due to mobility, language, dementia, mental health issues. And then there's the individuals with so many different appointments with so many different specialists that it would be a lot to ask to see yet another specialist. Next slide, please. So this is where we see the real value of eConsult, and I'm going to speak specifically to eConsult. So currently, eConsult is the patient and the referring provider decide that access to special advice and care is needed, and perhaps it can be done without a face-to-face visit. So the current Ontario system is that the referring doc would choose then to use an eConsult platform, and we'll talk about the different platforms. However, a traditional referral, whether it be done electronically or by the old fax method, when it's sent to a specialist, is generally triaged for urgency, completeness, appropriateness, necessity. And sometimes the referral is redirected to someone else. Sometimes there's a little bit of back and forth. And then the specialist visit is generally booked for that person, either in person or now more and more by virtual visits. However, we also know that many of those referrals could be managed by providing support and advice back to the primary care provider without booking that patient. And so eServices is really about bringing eReferral and eConsult together so that both the patient and provider have the option of just receiving advice or to actually have that visit. But eConsult, just to be clear, is provider to provider communication, not patient to provider. Next slide, please. So here's an example of how you could use it, and we've had as everyone now have a focus in long-term care, but it's been a priority population for us. So an elderly patient now residing in long-term care has progressive dementia, has a history of a fractured hip while taking a particular medication. They continue to ambulate independently and are at high risk for a future fall. They're unable to tolerate swallowing pills whole anymore, and the long-term care guidelines have a suggestion about a particular medication. The transfer for outpatient appointments have become increasingly challenging due to frailty. Could you recommend what treatment might be best in this frail ambulating patient? So a very specific patient question and a very specific specialist response about what medication might be useful and which one would be covered or not covered for that person. This is very different than what you get in a typical referral consult letter. And this is not an atypical type of question that we would see with eConsult. So the specialist provides advice, the primary care provider accepts the advice and is able to manage the patient without the patient needing to have a specialist visit. Next slide, please. So what is the vision of the eServices program? Well, we want Ontario patients to have informed choices for equitable and timely access to specialists and specialty services, and smoother and safer transitions in care using digital tools that improve that communication between patients and between caregivers. Next slide, please. So the benefits of eConsult and eReferral, and we've had lots of program evaluation and other research on this, but we do know that improved patient experience, so that quicker, more efficient access to specialty care and services, and whether they may not need that in-person visit, or when they come for that in-person visit, the appropriate work is done. For eReferral, especially increased involvement and visibility for patients during the referral process. Was my referral sent in? When am I going to have my appointment? And equitable access to specialty care by providing an alternative when in-person specialist visits are challenging or impossible. So those remote locations and mobility challenges. And that's why we strongly believe that all people in Ontario should have access to specialty advice no matter where you live. Next slide, please. We also know that it has improved clinician experience. And not all digital services have improved clinician experience, but we do know that both primary care providers and specialists are frustrated by the wait. So the more appropriate access to specialty care for patients. The median response, the expectation for an eConsult is that the reply will be given within 7 days. So you will get, the referring doctor will get or provider will get a reply within 7 days. But the median time is within 1 day. So the specialists have been very quick to answer the eConsult. And when needed, a more complete and efficient referral process when a virtual or in-person visit is required. So having defined clinical pathways and referral process actually makes that the in-person visit much more complete and efficient. We do also know that direct communication between providers has prompted learning, knowledge sharing, and improved care coordination. So it's been a useful CME tool for specialists to provide education back to primary care, but it's also been really informative for the specialists of what is primary care, what are the issues they're dealing with, and the questions that are asked are often prompt the specialist to go and learn more. And it's a more efficient and better documented communication. So between the other way of getting advice quickly is, of course, paging or phoning a colleague. But this is actually documented, which the CMPA appreciates, and so it's also something that you can then go back and refer to as well, which is very helpful for the primary care provider providing the care. Next slide, please. We also know that, especially with eReferral, there's less sending it out to 6 or 7 different specialists, just hoping that one will bite and book the appointment. In reduction in time contacting patients, so with the patient being included in the referral loop, less phone calls and emails required, and there's no need to track down lost referrals. Those faxes that go missing are not an issue when we have a true electronic referral system. So here's just a snapshot of the last year for eConsult. So you'll see it's from January 2020 to December 2020, and of course March is included in that. So on the right-hand side, you're going to see that there are 5 lines. The top line is the overall number of patients who received an eConsult per month. The green line is the Ontario eConsult platform, which is housed on the OTN platform. And you'll see between February and March a big jump from 2,877 eConsults to 3,600, and that number has continued to go up. And that, of course, we think is in part related to COVID and the increased access to the OTN platform and registration for that platform. The Champlain Base eConsult service is a very stable service. It's the one that we originally developed and has continued, so there was no drop-off with COVID. In fact, it went up a little bit. You'll see that telederm and teleophthalmology were reduced during the initial COVID, and that's related to the service model and the need for the patient to be seen to help upload the information. Dermatology continues to be the #1 request for eConsult. About 15% of eConsults go to dermatology, but you'll see the widespread, so hematology, OB-GYN, neurology, internal medicine, endocrine, psychiatry, pediatrics. So although dermatology is still the biggest, most commonly used, really the number that are going to all services is high. As I mentioned, the median response time is 1 day, so the referring provider is getting information back from the specialist within a day. Next slide, please. So this is the current menu of options on the Ontario eConsult service through the OTN platform as of August 23rd. So the referring doc or provider can access a specialist either by an individual specialist, but also by group. So you don't need to know who you want to reach out to for a medication request for geriatrics. You can choose geriatrics medication, and that question will be funneled to one of the specialists on that service. And the ones that are highlighted are because we think they're of likely special interest to you and your priority population. So addiction medicine, geriatrics, and psychiatry, but really there are no specialties that aren't represented on the provincial eConsult service. Next slide, please. Okay, I'm going to hand over to Mohammed.
Great, thanks very much. And Erin, just you guys can hear me okay?
Yes.
Okay, fantastic. Great to see everyone. I'm going to talk about the eReferral end. And so as Erin sort of mentioned, we're really looking at sort of that continuum of how they work together. But from the eReferral perspective, it's really trying to get patients access to a service. And there's some in the chat about, it's not just sort of specialty services, it's all services, sometimes social services. Many times they're the most important things. So eReferral is really allowing patients to get access to the services they need. And in this sort of area, I want you to think about your priority populations, palliative care, mental health and addictions, frail elderly, and the different services that you want to put around them to support them. And even COVID is a priority population. How do you support the COVID population with services? And so if you sort of think about that, eReferral allows you to get the service for the patient in a way that's transparent, that has sort of wait times for those services, that has those services available so that clinicians actually understand what's available. You can leverage a model like a central intake, where if you're referring an Ontario Health Team patient to a central spot, then that sort of central triage place can sort of enable different services for that patient. They can turn one referral into 5 different services, and that referral can flow to the 5 different services because it's digitized. Once that referral is sent out, then there's a process of getting it accepted on the specialist end or the service end, and so that can happen. And then information is sent back to the sending clinician so that there are sort of full transparency in terms of what's happening with their patient, what services are enabled, what's not enabled. And there was also something in the chat about patient transparency, and so this enables that. Through eReferral, patients are able to understand what's happening at every point of their referral. The referral's been sent, referral's been received, and they can confirm online. And as part of the work, we're looking at integrating eConsult and eReferral. We're certainly looking at patients getting access to the fact that they've had an eReferral done as well. You can see in the bottom sort of left there the most frequent eReferrals. And so if you sort of think about frail patients, orthopedics referrals, you think about psychiatry and sort of mental health and addiction. So hopefully a number of different services already on that are helpful for patients, but also an opportunity to say, these are the services that we need on, and our team is ready and willing to get them on for you so that we support your OHT in your area to get the services that are most relevant. If we move to the next slide. And so this is how you contact us. So please reach out. We're really keen to sort of help you to enable the services, to put together sort of a bundle of services for patients so that you can keep them out of hospital. You can provide them with the support that they need. We have teams in each region of Ontario Health that can support deployment to those different specialists and services and can help with onboarding. So there, in the appendix, there's a lot of information in terms of contact information. Please go ahead and either email those regular addresses there, generic addresses, or contact the specific people in your region. We have 100 clinicians helping us with this, and we have a formal clinical advisory group at the provincial level, which represents many OHTs, all regions of Ontario Health, specialty care, as well as sort of primary care. So we have good clinical sort of foundation, and they are allowing us to determine what are priority pathways. But we want you to as well. I think that's really key that we support your work on the ground. eConsult has proven a useful tool in many different domains, and long-term care is no exception. So if you sort of think about that population and how eConsult can allow you to get that expertise into long-term care, it's there for you to leverage and readily available. We want to continue to expand the services that are on eReferral and eConsult in a way that really supports you and the patient needs that you're serving. So please reach out to us with those ideas, and we're happy to sort of set up meetings with you to actually work through what's available and what we need to add to the platforms. If you add, this is the eReferral. So Aaron presented the eConsult numbers, the eReferral numbers. Obviously, there was a dip again in March at the beginning of COVID, but it's really taken off now since COVID. And I think, as sort of procedures are sort of ebbing and flowing, it's certainly going to be impacted. But I think that, as people are working in their offices in different ways, eReferral has supported their engagement with the rest of the system and allows providers also to communicate. And there was a question about sort of communication and messaging. It allows providers to communicate with each other. So it's a way to sort of electronically communicate around a referral as well. And people have found that helpful so they're not faxing back and forth. And so I think that, it's been sort of proven to be quite popular before the pandemic and especially during the pandemic. These are the referral pathways that are sort of available. These are, as a part of the eServices program, we are taking stock of everything that's available provincially. These are available on many different platforms, and a point earlier in the chat was about interoperability is key. If we can't sort of ensure it's easy for clinicians to launch an eReferral, for someone to receive an eReferral, and the patient to be aware of that, then we haven't really achieved our aim. And so as a program, we're taking stock of what's happening in all these services, and we're looking at how do we bring them together in a way that allows the different systems to interoperate. Moving to the next slide. And so this is where I'm going to hand it over to Claire.
Great. Thank you very much. Thanks, Mohammed. Thanks, Aaron. Right. So into the last section. So you saw the referral destination and the existing pathways that are there for eReferral and lots of gaps in many areas. And we also wanted to just briefly talk about 2 surveys that we did, and hopefully many of you would have participated in it, but if not, we do have a lot of data. So we sent a survey to primary care, and the 10,697 primary care providers is the number of people who are actually signed up on the OTN hub. So they have an account for one reason or another, almost a 10% response rate, and that's the breakdown of who answered it. Remembering that eConsult can be accessed by both family doctors and nurse practitioners. 10% were in solo practice, majority in group practice, and then 17% in hospital. Likewise, we did a specialist survey, and again, this was really related to eServices from an eConsult and an eReferral and referral perspective. So this gives an idea of who answered in terms of the specialist. We had about 450 specialists from across the province who answered. And these are the areas where the specialists were from, so psychiatry, peds, endocrinology, neurology, and cardiology. And again, just a little bit of a breakdown of where the specialists are working. So next slide, please. Oh, go back. Go back one slide. Yeah. So for the primary care providers, what we asked, and again, we want you to tell us from your OHTs, again, what your top priorities are. But this is a provincial snapshot, identifying that the greatest challenges in terms of referring are psychiatry, mental health, addiction, neurology. That was a bit of a surprise for us, dermatology, and gastroenterology. So those are 5 top referral destinations that we would like to recommend should be made available across the province. And again, looking for how do these align with your priority populations for your Ontario Health team, and then also any other needs that you have from your region. And then you can see the rest of them as well. So next slide, please. I'm just giving a little bit of a snapshot of some of the questions. We asked what are the, again, looked at it from a regional point of view, and I did just want to point out it was actually very similar across all regions of Ontario. Next slide, please. We also asked what are your challenges with referrals, and I think for family doctors who are on the call, this is not going to be a surprise to you, but the top 3 long wait times, finding the appropriate specialist, and then 60%, 61%, 85% across all regions cited no confirmation of receipt of referral. So a very high number still, and I think the big thing here is that electronic referral will eliminate that. So that's eliminating really that black box of I faxed in the referral and I never heard anything back. And that is despite the fact that there is a policy, I think, where you're supposed to respond within 2 weeks to confirm actually receipt of the referral. So a lot of opportunity. Diving in again, what we want you to use eConsult, we want you to use eReferral, we want you to sign up for eReferral, we want you to let us know your priority populations. And in case you're not convinced yet, here's a couple of more case examples. So this is an eConsult case for chronic pain. And again, you can read the question, neuropathic pain, leg spasms, using marijuana, fentanyl for pain management, and having issues with the patch adherence. So the primary care provider is looking for different approaches. And for all of us who are managing people with chronic pain, these are our long-term patients and we are looking after them for years. So here's the response: switching to an oral, from marijuana to an oral cannabinoid and suggests baclofen, refers to the opioid guidelines, and often those can be attached back. And the interesting thing is that offers ongoing dialogue. So remember, in an eConsult, there is that opportunity for bidirectional communication. So if it's not clear, you can ask a follow-up question. And if you want to keep the case open, try something out with your patient, you're able to do that. And next example. So here's an example of eReferral with chronic pain. So the primary care provider finds a chronic pain program and submits a referral. So as Mohammed had said, the referral destination on the eReferral does not only have to be a specialist or specialty service. We're now expanding and have already expanded to program level referrals. So again, you can read through it, sends in the referral. The patient receives the notification that the referral has been sent. Real-time referral status is added to the chart. The program receives the referral and they can basically look at it and then requires prior imaging. So again, you can have some communication back and forth, and by the time the patient actually gets that appointment booked and goes in, there's pre-visit workup that has been done, they're in the appropriate place, the appointment has been scheduled in collaboration with the patient, and hopefully it ends up being a very good appointment and is helpful to the patient. Next slide, please. I just have two more examples. So eConsult Psychiatry, we know that many of the priority populations for the Ontario Health Teams is for mental health, addiction, and psychiatry. So that is available to you right now. So here's a nice example of a primary care provider with a patient with depression. And really the question is suggesting altering the medication treatment. So often we kind of know what we're going to do and we just need confirmation or some alternate suggestions. So again, this was very specific related to the current medication, and the specialist recommended adding another medication. So day 6, primary care provider accepts the advice. We do have eReferral that's available on psychiatry right now, and this one is submitting a referral to a counseling group, and this again is related to a patient who has progression of depression with COVID-19 as a significant factor. The primary care provider looks at the referral directory and finds the virtual counseling group for depression exacerbated by COVID-19. So again, just a great example of how the services can be there, and we're looking to you to let us know who are the referral destinations that you would like to have for your regions. What types of services would you like to be added? And again, very open to meeting with you and discussing and then tailoring, especially on eReferral, the referral destinations that are going to be helpful, in particular for your year 1 priority populations. Next slide, please. So we'd like to do a little poll and ask you actually right offhand, what referral destinations do you need to support frail elderly patient population? And I think I'm just waiting for a minute and we get the answers, I believe, in the chat box. Is that right, Steve?
Sorry, yes. If everybody just wants to put in their answers into the chat box, that would be the best.
Yeah. So we've identified mental health, addiction, psychiatry, and frail elderly populations as the majority of, or I would say those would be the top 2 target populations for the OHTs. And again, add on, tell us what your other ones are. But if we were to put together referral destinations for this group, what is it that you're looking to cluster? What are your needs? So we'll look for that. So gerontology, geriatrician, geriatrics, yep. Beth says community outreach support team. So we're going to collect all of these. I'll leave it open for another 30 seconds or so. Bilingual, yes, oui, c'est très, très important. Je pense qu'on a la chance d'offrir des services francophonie and also in other languages as well. So now many of these, in fact, all of the ones that I'm seeing right now in terms of specialty services, even home and community care, we've tried that out with eConsult, so it's possible to link these. Palliative services are available. Yeah, and a discussion and like to see physio, OT, social work, and we're definitely have that on our radar and would like to do some follow-up on that. Dementia is close to home for myself as well in terms of some of the work that I'm doing. All right. Okay, so we're capturing all of these suggestions, and this is not the only time that you're going to get to, I guess, tell us. In fact, we want to follow up with all of you. So next slide, please. All right, what are the referral destinations that you need to support mental health and addictions? So who is it, which services, what is going to be helpful for you that we could leverage the eReferral and eConsult platforms, because they're both available services right now. So tell us, what do you need? Where are the gaps in terms of mental health and addiction support? Great, so I'm seeing local addictions and mental health services, yeah, and the neat thing now with the way we've been organized is we have regional groups in all 5 areas of the province, so and those teams have been working together for quite a while, and they are available to then work with each of you in your local region to create these tailored services. Pediatric community supports, yep, that's a great point. In Ottawa, I know that's one of the targets that we're working on. Residential addictions, yeah, absolutely. Those are tough services to get into. So great. So keep those referral destinations for this coming. And also, if there's other areas that we haven't talked about today, then I invite you in the chat again to identify the other priority populations and let us know so we can start thinking about that as well. Somebody has pointed out Indigenous psychiatry, absolutely. Francophone psychiatry, absolutely. And again, we're from Erin and I are from the Champlain, Ottawa region, and 20% of our population in this region is Francophone. Translation service for refugees, yeah, I did use that the other day in clinic. So, okay, so keep those suggestions coming. This is really, again, what we want to send the message is that these services are available. So you can immediately use eConsult and eReferral. And if on the referral destinations you don't see what you need as clinicians and as Ontario Health teams, let us know. And here again is our information in terms of the sign up. Our next steps, what we want to do is we're putting together a survey, and we will again do a follow-up with all of you, but I'd like to do a survey of all of the Ontario Health teams to identify this and really to get an idea not only of the priority populations, but what's coming up the pipeline. There's a tremendous amount of information that is available for your populations, and I know you've all been looking at that and doing a lot of work with your clinicians to figure out how to improve transitions in care, how to improve access. And again, the message today is that this is available free of charge. We have teams ready. All of you hopefully are already signed up for eConsult and possibly using it. If you haven't used it for a while, go back on because as Erin had shown in that initial slide, we have over 101 specialty services that are available provincially on eConsult, and then many, many referral destinations that are already available on eReferral, and we're looking to, as a eServices program, to expand that, and we need to hear from you in terms of the priority pathways. So I think I'm at the end of the slides, and we're going to now take questions and answers, and there's a lot in the chat, so I'll be quiet now, and I'm going to hand over to our moderator. Thanks so much, and I look forward to, I hope meeting some of you again in person, but otherwise, you know, it's quite easy to connect everybody virtually, so again, Mohammed, Erin, and myself are available for follow-up and really invite your invite you to reach out to us.
Okay, great. Thank you. Thank you so much. And thank you again for the presenters for that great overview, and hope it was informative to the participants and those who are on the session. So we're now into the Q&A session, and we've been collecting some of the questions throughout the chats. So why don't I just kick it off? And just as a reminder, we have the 3 clinical leads here. We also have Greg Hine from the Ministry and Angela Tabano from Ontario Health, who co-chair this eServices provincial program and will also be able to help respond to these questions. So the first one that I'll ask is there a rough timeline for the evolution of telehealth and the establishment of a digital front door? That might be more of a Greg.
I think that's a Greg and Angela.
Yeah.
Greg gets all the hard ones.
My front door in my house.
Great. I don't think we can hear you, and I think you're unmuted, but it's not coming through. At least I can't hear. Okay, maybe we'll come back to that one. The next question is there a strategy to onboard new providers as having access by default when they are licensed instead of when they sign up?
Maybe just, so I think, there is a sign-up process for a number of these things from the sort of privacy security perspective. I think we need to make that as easy as possible, and we need to support, onboarding once and access to multiple different services. So I think we have to keep on making it easier. I'm not sure we can default to all services. There are a few steps that are required, but you should have an onboarding package to one thing and then be able to leverage it. We are from an eReferral, eConsult end, we are very much looking at that. You're sort of have access to one service. When you are sort of enabled for that, you get access to both eConsult and eReferral. It does take some work on sort of the agreements and to ensure that happens.
Hi, sorry, in starting to respond to the previous question, it was dropped. So I think what might be helpful is we figure out the best time to come back with a similar session on the navigation service, because there will be lots of questions, I think, about how that provincial service will interact with some of the work that OHTs are doing now and are forecasting to do, because it really does affect some of the assets that you're using, not just Telehealth Ontario, but I know that you have your own directories of health services and that sort of thing. So why don't we, the team will think about the best time to do that, taking into account that it is a competitive procurement that we're going through right now. So we'll let you know. Thanks. Okay,
great. Thanks. So the next question is, what will be the mechanism to ensure compliancy of all eService companies for previous and future standards, including but not exclusively to interconnectivity of all of these services?
I'll take that one, and then Claire, feel free to sort of jump in. So we are working with Ontario Health and Ontario MD on standards to ensure that the vendors that we're currently using, as well as other vendors, are able to interoperate. It's not valuable if you do an automatic process in your EMR, then you have to sort of switch to another platform, re-enter the information, send it off, and then you don't get the information back. And so very much our approach is to ensure that we have an integrated end-to-end system where if you are sending off an eConsult and it needs to change to an eReferral, that happens. And if you're sending off an eReferral and it's responded to as an eConsult, that happens, and you're not leaving, you're not having to sign in again. You're leveraging sort of that functionality from your electronic medical record, your hospital information system. We're not getting people to leave. That's the work we're doing. That we are working with Ontario Health on what's called the Firearm standard, and really moving forward towards that. So that for sure is what we're progressing towards. And I don't know if Angela, I can see you.
Yeah.
I don't know if you want to chime in on that as well.
Sure, I can add to that. Can you hear me okay?
Yes.
Yeah, okay, great. Yeah, thanks, Mohammed. And I just wanted to note for the group that that really is one of the primary roles that Ontario Health is bringing to the table. We're working very closely with the eServices team, but really across the province. You know, Ontario Health's role is to ensure that these provincial services that are being developed are available across the province for anyone who needs it and across for all of the vendors who can participate. And that really comes down to interoperability and data standards. And that's really a role that we're looking at and certainly will be supported by the Digital Health Information Exchange program that is setting up. So very much focused on not just specific end-to-end solutions, but standards-based solutions that can incorporate and be used by multiple vendors.
Great, thanks. The next question is, of 10,697, I think this is regarding the survey that was sent out, do we know how many are considered active users? And could OHTs get a report so that we can work on engagement with primary care?
Oh, yes and yes. So we define active users as initiating 3 consults in the last 6 months, and we do have all of that data. So I'm happy to share that data. We've already started to break it down into the regions, and you'll see in the appendix we have some more of the data from the primary care survey and the specialist survey. And yes, we can do a follow-up, and then already your regional teams for eConsult have that type of information to that level. So absolutely yes. And somebody had also asked if you have an OTN Hub account, can you get access to eConsult? Yes, you already have it. So sign in on OTN Hub, and then you'll see you can initiate an eConsult right away. Nothing further needed. So very easy and simple access.
Thanks, Claire. The next question is there progress made on linking imaging in the form of PACS or other viewers as if we were able to link eConsults to DI? Then we would be able to get a more complete consult, which is a common barrier. I think that might be an Angela question, or?
Sorry, sure. I can certainly, certainly from a provincial perspective, we have a provincial DI viewer that can give you access to DI reports from anywhere across the province. I don't think at this point we've actually integrated and linked that to the eServices, but those 2 services are available. I think it's a really good point, and that point of seamless integration is something that we could absolutely look at.
Maybe just to build on that, like in Alberta, they had the ability to do that, where they could use their electronic health record and then pull in information both into the eConsult and eReferral so that you can send that to the specialist. So if you're sending a CT, you would essentially send the link to the CT within the eConsult. Then the specialist could click on that button. It would pull it from the provincial repository. So they had that CT to look at while they were answering the question, right, which is extremely powerful. So I think, I think there's a tremendous opportunity for that.
Agreed.
We do know that some of the specialists will do that on their own when they, being able, if you're in a community of practice and they're working in the hospital, they may go and view the images on their own, but it's not ideal currently, but a lot are doing that.
Great, thanks. The next question is, can you comment to what extent the question of resource allocations for enabling adoption has been expanded to ensure effective change management, including resources like clinician experts and funding, either one-time or changes to billing supports?
I can just chime in on the change management process. We very much sort of understand the value of that, and so we've got teams on eConsult and eReferral working together as part of eServices. We are actually working with our clinical advisory group to refine that, to ensure that there are fewer knocks on the door, that we can leverage those resources in the most effective way. And so very much, we appreciate that there needs to be support on the ground to get these things embedded into the clinician's workflow, into the OHT, in a way that's meaningful and has high use. I don't know if Aaron or Claire, you have any other comments on that.
No, I would just like to highlight our regional partners, though. We're doing a great job at that, and we do have a regional advisory group that are working really hard at having sharing successes, although we have learned that each region is unique in as far as the primary care provider kind of culture and organization. Clearly, we have other partners who are involved in change management as well, who we work closely with. We feel the more people delivering a message, the better.
Thank you. The next question is, where does digital secure communications between and across healthcare sectors such as public health, social organizations come under eServices?
So I think where it comes under eServices, from my perspective, is around the coordination of that patient's care through an eConsult or eReferral. So if you are sending out an eConsult, then you have communication, as was sort of mentioned earlier, you have communication back and forth by Aaron. You have communication back and forth around the eConsult, and the same thing with the eReferral. If you're asking to sort of send a patient off, but you need to sort of clarify some information, you do that sort of around the eReferral. Secure messaging by itself, we're not currently dealing with that. Like, that's sort of different. What we're dealing with really is around a referral and a consult. How do you communicate? At the end of the day, all this stuff has to be connected in some way. And I think that's sort of what we're sort of seeing with some of the questions is, how do we put these things together, these puzzle pieces together to help the OHTs in a more comprehensive way?
Yeah, and I would just point out on eConsult that there is a delegate feature. So if you still have to have somebody who is the MRP, most responsible provider, and this is about a patient who needs access to something, but there are features that then allow, if you have a team or a navigator, for example, within your clinic or your OHT, I think there's things that can be done to then have leverage the eConsult and eReferral and have access to team members whilst the provider still remains the MRP for the patient.
Okay, thank you. I think this is probably going to be the last question and kind of comment as well. eConsult and eReferral work well, but the challenges in our OHT around digital are for information flows between hospital and PCP and between the health services and community services. Is anything being done to help with these flows?
So I can take that as a starting point. Absolutely, aside from eServices, the data flow between organizations is top of mind on what we're looking at as we provide provincial services. And so many of the agreements and onboarding work is around the authority to share information across organizations. So there's a technical integration to get systems to talk to each other, and then there's a piece of policy authority level to say that these organizations can share information. And as we look at any provincial services, we are looking at how do we make that more integrated, and certainly with the OHTs, that's a big piece of the puzzle. We have set up regional advisory groups where we're really focusing on the provincial services and the local services and what's the path for sharing seamlessly across the various services. So definitely a work in progress, but a very important topic that we really need to stay focused on.
Okay, great. Thank you very much. And I think that brings us to the close of today's session. Thank you for joining. Really appreciate everyone's time, and thank you to the presenters and panels as well. Just a reminder, I think we're going to post the material and also this recording on I believe it's on the Rise website. But please do reach out to Claire, Aaron, Mohammed, or the eServices, eConsult, eReferral team to learn more. Thank you, and have a good day, everyone.